Good evening, everyone. My name is Dr. Esra Shermadou. I'm a board-certified obesity medicine physician here in Dayton, Ohio, and owner of Sakina Health. And we are talking all things visceral fat, testosterone, weight loss, and why some people feel like they are doing everything right and still cannot lose weight. So this month is Men's Health Awareness Month, and so we're going to focus on some questions that we have been getting. Men's health, the most common questions have been about testosterone, although we know that testosterone is not the only thing that makes up men's health. There's so much more to it than that. Thank you guys so much for sending in all the questions. I really appreciate it, and definitely keep them coming. All right, so we're going to get to it. So our first question here is, how do I know if my testosterone level is low? And this is a great question. I get this all the time. Really, there's no specific number. Yes, we look at numbers for sure, but there's a lot more to it. You're more than just a number. We focus on the symptoms as well. And so when somebody comes to me concerned about their testosterone levels, I always ask them why. What symptoms are you having that's making you concerned? And some of the most common ones that we see are going to be, fatigue, low energy, not having that initiative or drive that you normally have, irritability, not really knowing why you're irritable, and then low muscle mass, or not, you're going to the gym, working out, lifting weights, and feel like you're not able to build muscle despite all of your efforts. Increase in belly fat is another one that we see as well, low libido or problems with erectile dysfunction, brain fog. Those are some of the most common ones. There's so much more, and it's going to be different for everybody. But you see, all those symptoms are kind of vague too. A lot of different things can cause these symptoms too. And that's why it's important to kind of get the whole picture about lifestyle, what's going on in your daily life, what are you eating, are you exercising? There's so much more to it. And then of course we look at the numbers and kind of see what's going on, and putting the two together is kind of how we determine whether or not you would qualify or you might benefit from treatment. Always, how do I know if it's low? A lot of times guys will come in, they focus on a number, but there's so much more to it than that. You're more than just a number. Another question that kind of goes along with that is, what is considered a normal testosterone level? Also a great number. Guys just, come by and tell me like, hey, this is my level. I'm like, great, awesome, that's cool. Because again, it's just a number. It doesn't tell me very much. There's such a wide range. If you get your labs drawn, you'll see what's considered normal on the labs, and it's a huge range. And so what's considered normal for one person may not be normal for the other person. It might be low for the other person. So oftentimes we're looking at numbers between greater than 300, depending on which guidelines you're going by. But again, it comes down to what symptoms are you having and how do you feel. You might have one guy who feels fantastic at a level of 500 and another guy who feels like that number is really low for him. The other important thing that when it comes to testosterone and what's considered normal is that we have to look at your free testosterone levels, not just your total testosterone. So when we have testosterone in our body floating around, it's often bound to different proteins. One of the proteins that it's bound to is one called sex hormone binding globulin, and this holds onto testosterone so tightly that it's not really available to go to other tissues in the body. And so it's kind of as if like you really don't have that testosterone available. It's not doing you any good. So if you have high sex hormone binding globulin levels, that can affect your free testosterone levels, what's available to bind to your tissues, like your muscle tissue, your brain tissue, the other organs in your body. So that's something that we have to factor into as well, because again, two males can have both total testosterone levels of 500, but one might have a free testosterone of 10 and the other one might have a free testosterone of 20 or 7. And so it's very different. So we have to look at sex hormone binding globulin levels as well as the free testosterone. That's most important. And again, coming down to the symptoms, because it's all part of the story. And what else is going on in life too. Very hard to say there's no specific one normal level for everybody. It's just different. We're all unique individuals. Can your testosterone levels be too high? Absolutely. So signs of high testosterone can be, number one, you can have thickening of your blood. So we look at your hematocrit and see what that is. If your blood gets too thick, that can lead to other serious conditions like cardiovascular conditions. So we're always monitoring that. It can lead to increased breast tissue in males. It can affect your libido as well. can be also due to your estrogen levels, increased aggression or mood changes as well. Having too low of testosterone can cause symptoms, and having too high of testosterone can cause symptoms. So we kind of want to be in that middle range. A lot of times guys who might be started on testosterone therapy will wonder, or, always ask, like, oh, can we go higher? Can we go higher? And, what's the goal? Like, if you're feeling okay, your other lab values are within normal limits, it might be a possibility that we can increase a little and just kind of see how you feel and make sure you're not having any side effects. Make sure your other blood work is also staying in range. But, the goal is to be optimized and not to go as high as possible, because that has a lot of significant concerns too. And sometimes the benefits are not there. It's not worth it. You're going to have worse symptoms. So again, we are going for optimization, not for the highest levels of testosterone. A lot of times people are complaining about visceral fat in their belly fat area. And so when it comes to fat, there's different types of fat in our body. We have our subcutaneous fat, which is the fat that you can just kind of pinch on your skin. And that's relatively not harmful. It's, can be unpleasant to some people. They don't like the way it looks, but in general, not causing terrible harm to the body, of course, within range. But then we have a visceral fat, and that is actually metabolically active, meaning that it's releasing a lot of chemicals and hormones that increase your risk of developing diabetes, heart disease, insulin resistance, high blood pressure, a lot of those chronic conditions. That is something that we really want to pay attention to and monitor and try to decrease as well. When it comes to visceral fat, you may not be able to feel it. It surrounds your organs, so it's very deep, around your liver, your intestines, your kidneys. It's deep in there. So you can have somebody who looks skinny, doesn't look like they have a lot of excess body weight or body fat, but internally they actually have a lot of visceral fat. And so it can be very deceiving, and that's where things like, a DEXA scan or an in-body scan and other ways to kind of measure visceral fat can be very helpful. And so that is one thing that I definitely pay attention to when my patients come and see me is, what's your visceral fat? Very concerned about that, because it can lead to a lot of serious conditions. And so we definitely want to keep an eye on that. Now, how can we lose it? There's a few different things that we can do to help reduce it. So we know that visceral fat is going to increase, or we see it increase around times of like perimenopause, menopause, and in males as their testosterone levels decrease. All of these with females, it's associated with the decrease in estrogen. We see the increase in visceral fat and insulin resistance. And so with males, we see it with their testosterone levels as well. So hormone therapy is something that we are able to take, then that would something that can help reduce or minimize the amount of visceral fat that you would gain with age. But when it comes to lifestyle, this is huge. So when it comes to lifestyle, we know that chronic stress is going to increase your visceral fat levels. And this is why sometimes like the belly fat area can be difficult to lose, is because your body holds on to that kind of as a safety mechanism. And so if you're chronically stressed out, your cortisol levels are chronically elevated, then your body's holding on to it kind of as safety. So if we can decrease stress, we're never going to be able to completely eliminate stress, but if we can figure out how to deal with it, this is going to make a significant difference. I've had patients who, we've worked significantly to help manage their stress throughout the day. So whether we work on techniques to help them, just kind of calm down, whether it's breath work, journaling, making sure we're getting our sleep regulated, getting a sleep routine down, all of these things can help decrease stress. And once we kind of get that down, we kind of see that they're starting to release some of that visceral fat. And so stress management is going to be significant. We also want to make sure that our exercise isn't inducing more stress on us. So if we're doing a lot of daily like HIIT type exercises, like high intensity exercises, that can increase our stress levels if we're not resting or doing things that are less stressful to the body. So that's why doing other exercises like strength training, of course, is going to be helpful. And strength training also builds muscle. And we know that muscle is metabolically active in a good way, meaning that it's going to take up some of the glucose. It's going to decrease your insulin resistance. And that will in turn also decrease your risk of the other conditions too. So muscle is very important for many different reasons. And one of the things that it helps with is helping to reduce the visceral fat. Other ways, so we said that visceral fat is inflammatory. It releases inflammation and it causes inflammation. So if we can decrease inflammation in our body through other means like our diet, that's also going to help decrease our visceral fat. So we think of ultra-processed foods. Those can cause a lot of inflammation in our gut microbiome. and that will also increase our visceral fat. So we want to focus on like whole grains, whole foods, lean proteins, vegetables, of course, healthy fats like avocados, walnuts, olive oil. All of those things are going to help to decrease our visceral fat too. And sleep, kind of touched on it a little bit, but that's so important for regulating our hormones. It's kind of our body's time to rest, recover, kind of get ready for the next day. And so if we're not sleeping enough, if we're waking up throughout the night, that can also, our body's not able to just relax and recover. It's constantly up, and so that's going to affect our stress levels as well too. So all of these lifestyle habits are so important when it comes to reducing visceral fat. And it's definitely challenging as we get older. We have a lot going on. We have a lot more responsibilities. Our life is more stressful and more hectic, and so it can be challenging to get rid of this fat. And that's why it's important just to take things one at a time, work with somebody to help you to kind of focus on these like different factors to try to reduce our visceral fat, but definitely possible. All right, are there any foods, and I already kind of touched on this, that there's no one food that's going to decrease your visceral fat levels. It's going to be kind of that whole foods approach. So focusing on our whole grains, vegetables, lean proteins, healthy fats, decreasing ultra processed foods, all of that is going to help decrease your visceral fat. So diet, lifestyle is so important when it comes to this.